Why buy your next vehicle from Community Motors of Mason City?
Great service from 3 locations: Community on Monroe, Community Motors Westside, and Mason City Ford. 10 new franchises and hundreds of vehicles to give you more choices. Plus, Community offers an exclusive 3-3 warranty on pre-owned vehicles and 10-year, 250,000-mile warranty on new. Need more reasons why? Stop or visit CommunityAutoGroup.com.
Because nobody beats a community deal. Nobody.
My name is Matt Sinovic. I'm the Executive Director of Progress, Iowa. We're here today to celebrate yesterday's Supreme Court ruling upholding Obamacare. The ruling, which was agreed upon by both Republican and Democratic Supreme Court justices, is a tremendous victory for all Iowans and Americans because they will continue to get the health care and insurance coverage that they need. Seniors remain safe from the prescription drug donut hole and can continue to receive free preventive care. People of all ages are still protected from being at the mercy of big insurance companies and can't be denied coverage because of pre-existing conditions. And young adults have a brighter future because they can still stay on their parents' insurance until age 26. The ruling by the Supreme Court should also be the end of conservative partisan attacks and fighting over Obamacare. It's time for everyone to join together and move forward to fully implement the law. We've got a terrific lineup of speakers today, including Senator Amanda Reagan, Representative Sharon Steckman, Midge Slater with Iowa Alliance for Retired Americans, and Molly Tafoya from One Iowa. So I'll go ahead and turn it over to Representative Sharon Steckman.
Thanks, Matt. I was pleased with the decision, obviously, and also pleased that it's finally behind us and we can move on and implement some of the great things in that healthcare plan. Right now, over 3 million young people are on their parents' health insurance because of this plan. In Iowa, let alone, there's over 18,000 young people that are now added to their parents' healthcare plan, which is a huge issue for a lot of these kids graduating from college, out looking for a job. They need to have healthcare insurance, so now they can be on their parents' policy until such time that they're with a company that offers it. So I was real pleased to see it turn out this way, and anxious to get it all implemented and move forward with it in the state of Iowa. Over 40,000 retired folks could saved money in Iowa on their prescription plans also, just because of this. So there are a lot of good things that will come out of it, and I'm glad to see the decision behind us so we can move forward. Senator Reagan.
Well, thank you for coming out today. The ruling kind of put a twist on the way people are talking about the healthcare legislation, because now there's more facts getting out and more people are actually discussing some of the things that are in it that, in fact, the seniors that have been utilizing the prescription drug may not even be aware of some of the advantages of healthcare. One of the things that I hear regularly are people that are uninsured, and what they use for their health care is the emergency room. And that's a cost that increases cost for all of us, because if they're not getting their health care and waiting to go to the emergency room because they have no coverage, that's a pretty big deal. Also, people are utilizing the emergency room because they haven't done any of the preventative care, and that preventive care, when we're blue zone, we're all talking about getting healthy, getting those checks, whether it's a mammogram or all those other things that we try to take care of ourselves with. We should be looking at that, and this will be another piece of that, is to make sure that we have that preventative care that makes us be a healthier state. So I think there's a lot of details, a lot of stories we could tell, but I continue to regularly get, and I'd say at least once every 2 weeks, someone comes to me and talks to me about how they have no health care or they're in need of services for their health care. So the costs are phenomenal for them, and we want to keep the whole state a healthy state. So Midge?
I'm Midge Slater. I am the state organizer for the Iowa Alliance for Retired Americans. We're a grassroots organization nationwide who work to organize seniors on our own behalf. We feel that although all ages are important, there are many times when seniors get left behind because there seems to be an assumption that once you're on Social Security and Medicare, you're taken care of. Well, that is an incorrect assumption, and that is why what happened yesterday was so important for retired Americans. It helps us to continue to be able to afford health care. You know, Medicare, for anyone over 65, is our health care plan. And since it was passed in 1965, there have been opponents who have been out with the sole desire of killing Medicare and getting rid of it because it did not represent what they would like to see. However, in Iowa, this is how important this health care plan is for us. This, what I still call the Patient Protection and Affordable Care Act, because I like that name. Although I also agree that apparently Obama cares. In our state, over 42,000 Medicare beneficiaries, since the law went into effect 2 years ago, have already saved a total of $25,876,475 on their prescriptions. 388,676 Iowa seniors have received free life-saving tests for chronic diseases. For 611,000 Iowans, private insurance has added coverage of preventive services without cost sharing. That is extremely important when you hit the fixed income. And seniors who have begun to see some relief from inside the donut hole, meaning that 50% of the full cost of brand name drugs and government subsidies for generic drugs has already kicked in, can now look forward to 2020 when that hole will be eliminated and they will no longer have to pay twice for the same prescription drug coverage, because that's really what the donut hole was, double taxation. I have to tell you, the other day I was in a grocery store standing in line to get my prescription. I was behind an older woman who was advised by the clerk that it looked like she'd hit the donut hole. And the woman really didn't quite understand, I could tell by her body language. And the clerk explained, well, you know, they're billing you $354, which is 50% of the cost. So you are in the donut hole. My mind went immediately to recall that prior to the Affordable Care Act, she would have been paying 100% of that prescription until she got to the point where she was out of the donut hole again, which usually didn't happen because that would have been the end of December, and then January 1, the whole thing started over. She, of course, paid with a credit card. So she's paying 50% of her prescription on a credit card. That should not happen. As of 2020, it won't. And when they buy that prescription plan will cover their prescriptions. The crackdown on Medicare waste, fraud, and abuse that has already saved $10.7 billion will continue securing and protecting the benefits that seniors have earned, giving hope to the 8.5% of seniors in Iowa whose incomes put them below the federal poverty level and who would not have access to health care if not for Medicare. And I can give you just a tiny little statistic in Cerro Gordo County. We are part of a study of the 99 counties in Iowa that we did with the Gerontology Institute at the University of Boston. They took a look at every county and what it actually costs to live economically secure as a senior in this state. In Cerro Gordo County, across the board, whether you're single or married, as long as you're 65 years old, your average expenses in the county monthly are $428. Now, I know there are people out there for whom that is half of their Social Security check, if they're lucky. Because, at least as I said, 8.5% of those on an average across the state fall below the federal poverty guidelines. Yesterday will be a short-lived victory if this November we fail to elect a president and a Congress with the courage to stand up for seniors and the middle class. A repeal vote in the House, which is scheduled for the week of July the 9th, will provide an opportunity for lawmakers to show their constituents where they stand. And it is important for us to know how that vote goes down in the House. Now, in the state of Iowa, we also have a challenge. We need to work for a health exchange that will represent the people of Iowa and not be run by a board behind closed doors. And we need to work for that expansion of Medicaid that was the one exception in the Supreme Court ruling. The states won't have to go along with the expansion of number of people covered. We think it's important that we work for that because it is based on a certain percentage of the federal poverty guidelines, which, as we know from our elder index, is not a good measurement anymore. It's just not enough money. Yesterday was a tremendous victory for Iowa's seniors, our children, and our grandchildren, but we can't rest on our laurels. And in the 2012 elections, we cannot let politicians roll back the progress we have made in this country on behalf of seniors since 1935. Thank you.
Hi everybody, my name is Molly Tafoya and I work for One Iowa. We are the state's lesbian, gay, bisexual, and transgender advocacy organization. And I'm here today to talk about the Affordable Care Act's impact on the LGBT community here in Iowa. Very simply, yesterday's ruling was a ruling for fairness and for justice and was a huge step forward towards full equality for LGBT Americans. LGBT health disparities are a serious problem. Higher rates of unemployment, higher rates of lower rates of positive health incomes, these are all factors that impact the full equality of the LGBT community. And President Obama and his administration, since taking office, has understood that bias and discrimination have been contributors to lower health outcomes and increased health disparities for the LGBT community. Because of that, the Affordable Care Act addresses these issues in many ways. I won't go into all of them. There are a lot, which is a very positive thing for us, but the first thing I want to note is there are provisions in the ACA that call for greater funding for data collection. Far too long, healthcare providers just don't know what the issues are that are facing LGBT patients. If a lesbian mom comes in to visit her doctor needs to know what the issues are facing her and her children. The Affordable Care Act would provide more information and get more resources into the hands of healthcare providers. The second issue that is huge for everybody, seniors, LGBT people, young people, is the Patient's Bill of Rights, which ends lifetime limits on coverage. Now, people living with HIV and AIDS reach that limit very, very quickly by making prescription drugs more affordable and by getting rid of the pre-existing condition limitations. The ACA goes a long way towards helping Americans living with HIV and AIDS. That's a huge issue for our community, and we're going to continue to fight to fully implement that so the LGBT community can access those resources. The other piece is there are non-discrimination provisions that in private health exchanges, we want to see that continue. You can no longer be denied private health insurance exchanges on the basis of your sexual identity or, sexual orientation or gender identity. This is a huge issue. And then, of course, preventative care benefits all Americans, including LGBT Americans. Free HIV testing and screening means a great deal to many Americans and means a great deal to the LGBT community. Finally, I do want to address the fact that the one piece of the ruling is limiting Medicaid expansion. Now, because there are higher rates of discrimination and bias in the workplace, particularly for transgender Americans, we see lower rates of employment, and that reflects in health insurance coverage. A 2011 study shows that only 57% of transgender Americans have health insurance, compared to, you know, whatever the percentage is for heterosexual counterparts. That's a serious problem facing people who are already at lower levels of health outcomes. So we are going to fight and work with our allies to make sure that Medicaid expansion is a priority for Iowa. I know that, you know, Iowa doesn't have to expand Medicaid coverage, but we really think that we should, because it protects the most vulnerable members of our society. Basically, the American dream of being able to live a healthy life and to protect your family and protect the health of your family is alive because of this ruling, and you shouldn't be denied that because of your sexual orientation and gender identity. The ruling upholds these values of fairness and justice. The Obama administration understands that, and we're very excited about this ruling. Thank you.
So,
You're the closer.
right,
Yeah.
okay. Well, that's really, we want to thank everyone for coming. Yesterday was a great day for Iowa, for the entire country, but we all know, as we all have said, that it's just the beginning, and that the fight will continue for better health care here in Iowa and everywhere across the country. So, well, I think we're just open to any questions that you all have. So, thank you.
I know the Republican response yesterday to the ruling was, that the Supreme Court used the word tax. And Republicans are saying that voters are gonna use that as their backlash polls in November. I'd just like to get your reaction on whether that is a worrisome point for Democrats or not heading into the election.
Well, right now, right now, you know, the people that Senator Reagan talked about going into the emergency room, all of us are paying for those people without health insurance. And when you get everyone taking health insurance, your pool grows. You know, I don't see how that is going to hurt our economy at all. So I don't see it as an issue. There are so many good things about this healthcare plan. I mean, the pre-existing conditions, the preventative care, the young people being able to get insurance. My husband is, diabetic, and he wouldn't be able to get on a company's policy because of those conditions.
And you can
And the
consider that,
bankruptcies.
and that was one of the examples I had just last week, was a woman came into my office about something else and started talking about the affordable health care, and she said, oh, that's a bad thing. And then she started talking about, well, I'm a certain age, I'm 62, but I can't get health care, I have to use an emergency room. And I can't get health care because premiums are too high, and because she has diabetes, she's not insurable. And then the statement went on, and she had a daughter who had no health care, 36, in her 30s, died of cancer, no health insurance. These are local folks, and these are people that are really experiencing, and we could tell you more stories. I know these guys have them from other parts of the states, but they're local stories here as well, and this is about access to health care.
And I think as those stories come out and as people realize the benefits of the program, that will outweigh things they've heard that they feel are.
Well, part of it is educating people on what's actually in, and I think the press has done very good in the last couple of days talking about what's really in it, and until this point, it's been both political sides talking about what they think is in it, and this has been very good about getting some of the facts out, and that's our job as part of leadership to make sure that people are aware of the different issues.
And one charge of the legislature will be to set up that exchange.
The exchange, and we've been talking about the exchange.
We've been working on it for 2 years now.
Very close, just a few little things that didn't seem to go over well with both sides. So I think there's going to be some progress.
And that's why I'm happy that the decision's out, because now we can move on and get started on those things. That's important.
Well, and explaining the exchange to the rest of the world is gonna be difficult, because all of the states will have a different exchange, and that whole piece of legislation is gonna be another thing that we have to educate all people on, and that's a big piece of it too.
And if we don't come up with ours, then the federal government will decide what ours will be. So I think it's better if we can work together and get it done as a state, rather than let the federal government give us their
I mean,
plan.
do you think it's so bad? I mean, you would not want children kicked off of insurance policies. I mean, that's a piece of this. I just think some of the things that are really critical.
And the limit with the bankruptcies, with the limits on the policies. Anybody else?
But most people aren't gonna do, and who does? We're all in our busy lives and don't take time to actually see what's in the whole healthcare. And it's very complex, ruling, so this isn't gonna be all figured out in 2 days either. These guys have it all figured out. But to tell the truth, it really is very complex, and I think Senator Grassley even mentioned that today. It's a big ruling.
Anything else?
Joanne, yes, you could talk.
When people hear the pieces of it, like the things that you're
Yeah,
talking
they like
about,
that.
they like it and they support it. What they don't like is the name Obamacare has been demonized, but they like the parts that are in it. And I think there's gonna be a big, big problem if the whole thing is taken away. Then there'll be, you're gonna have folks in the streets, but.
Well, and it's, for example, the seniors not realizing they even get that.
They may be getting benefits they
The
don't
woman
realize.
that
Right.
Rich was standing
Yeah.
behind didn't realize that a year ago she would have paid full price because of the donut.
And when I signed up for Medicare, I got one lifetime screening when I signed up. Now I get one every year. I mean, what
That's
a way to stay
preventative.
healthy
Yeah.
when you reach those, and I don't call them golden years. There's nothing golden about this. But as you age, you do have more health problems. I mean, that's just a given. So doesn't it make sense that you get one opportunity every year to go in and sit down with your doctor and say, okay, what's going on now?
I did hear somebody say the other day that they thought total medical costs are gonna go down because people will get the care they need before it
Before
becomes a
it's-
serious
Well,
problem.
that's the other piece, but if we don't have this, is any going to address medical costs, the uninsured, and all
You
those
won't
other
wait till you're in
pieces.
a dire situation to seek help.
And the thing about Medicaid cannot be taken too seriously, because when you talk about Medicaid, you are talking about those of us who are the poorest. And there's no advocate. I mean, they
No
could-
lobby?
No lobby, no big fancy lobbyist. And that is a group of people who really need this, and to expand that would be a very good sign of a compassionate society.
The first year I ran for office, I'm out knocking doors, and, I haven't had to deal with the donut hole myself, so I really wasn't aware of it. I knocked on the door of this older couple, both, retired, and he had actually worked for the Globe for years, had a really good job, and thought he could live through, had enough money saved. Well, he's in his 90s now, and they were in the donut hole. They had to borrow from their kids to make their house payment and to make everything work, because they were trying to live just on Social Security. And then we're in the donut hole, and we found a prescription exchange for them down in Des Moines. But, this was my first encounter with that kind of a problem, and it's terrible to think someone that worked hard all their life, and then they have to worry about that.
And we get stories from people across the state who come to us with stories of discrimination in the workplace. I mean, whether you're gay or lesbian or perceived to be, or even harder still, being transgender is extremely difficult. And luckily we have workplace discrimination protections, but it's not foolproof. We have a lot of work to do. But if you're facing a hostile work environment, there's a pretty good chance you're facing a hostile healthcare environment as well. And the ACA goes a long way in addressing some of those issues, just by including cultural competency trainings for healthcare professionals, so they know what they're dealing with when a transgender patient walks in the door. What are the issues? Because they're not always the same. And so, but when you look at workplace discrimination, that contributes to higher rates of unemployment. Higher rates of unemployment mean you need more access to Medicaid. So expanding Medicaid services is extremely crucial for our community, and for low-income Americans, people of color, and if you happen to be all three, you need a lot of help. So why wouldn't you help the most vulnerable members of our society? It's extremely important, and One Iowa is committed to working with our friends and allies in the legislature to expand that coverage. That's our promise.
Anybody else? Questions? Thank you for coming.
Thank
Thanks
you.
to Public
Thanks.
Health here. Thanks for coming.